Let me tell you a story how I treated chronic leg pain without even touching it. Patient came in with pain. It was like shooting down her thigh. The pain was described as sparky and would come and go quickly. Very classic for nerve pain. We're thinking nerve pain right off the bat. Now, when you have nerve pain, you can have localized nerve pain, you can have centralized nerve pain from the back. Now, if it's coming from the back, most commonly, it's not going to be local to an area. It's going to travel to the foot. Well, I asked, is it travel down? She's like, no, it's very localized, no back pain. So we're not thinking nerve pain from the back. So we pull that out. We're thinking nerve pain from a muscle. Then I was asking, is it aggravated with movement? She goes, no, I can be sitting, I can be standing, I can be walking, I can be laying down in bed. I just get these sparks. We kind of ruled out muscles because if muscles were involved, it would be aggravated with movement. We're getting localized nerve that is firing. Now this is kind of a cutaneous nerve, or a nerve that's localized to the skin that is overacting. I want you to think about that overactive nerve. We're going to set it aside. I generally asked, what else is going on? She goes, my sleep is really bad. Great, tell me about your sleep. And she goes, I go to bed at 9 and I always wake up at 2. Like, that's not necessarily a normal. Do you feel rested when you wake up? She's like, no, I definitely don't feel rested. Do you have a hard time falling asleep? She goes, no, I fall asleep great. Then I asked this question, do you sleep better on vacation or when you're at home? She said, I actually sleep worse than when I'm on vacation. I sleep great at home. What I'm trying to figure out is there something that's happening at night, a pet, a husband, air filters, or something that's making your sleep worse? Her sleep at home and the environment at home is conducive to sleep. We've kind of ruled out home environments. The next thing I asked is a better night's sleep when you're tired, or do you get a worse night's sleep when you're tired? She goes, I get a worse night's sleep when I'm tired. That's good to know. The next question you can ask is if you take naps during the day, do you feel like you sleep better at night? She says, yes. What this is telling me is that it's kind of counterintuitive. If you are under-rested, you sleep worse. The more tired you are, the worse night's sleep you have. When you have sleep problems, the next is you got rest and digest. The next question is digestion. How is your digestion? She goes, my digestion is horrible. I've had C. diff. I have a really hard time with my digestion. Come with me on this. When your digestion is bad, your nerves will be a little bit more inflamed. When your sleep is bad, your nerves are a little bit more overexcitable. Poor digestion will make your sleep worse. She came in with a problem of nerve pain in the thigh. She has a history of poor sleep. She has a real problem with digestion. That's your easy way in. If you fix her digestion, her sleep is going to get better. It's going to decrease this random nerve pain that's going down her leg. That's kind of what's going on. She needs to do naps. We need to give her herbs to fix her digestion. That will fix that leg pain because she's just overexhausted. Hopefully that was helpful and interesting.